Hello, I'm Brooke Billingsley with the Healthcare Experience Foundation, and we've teamed up with the Maryland Healthcare Education Institute, MHEI. We're honored to provide you just-in-time tools to support and strengthen your leadership skills as you face this unprecedented pandemic. Together, we created the Compassion Tribe video series. So how do you manage patient perceptions in today's ever-changing climate? I've spent the last 25 years studying patient perception. So today, we're going to reflect on the rapidly changing perceptions that impact the patient experience, provide you with takeaways to understand and manage those perceptions, and equip you to connect with compassion and empathy. So now we know there's no visitors included in the COVID-19, which has created a whole nother dynamic to the patient experience. So how do you manage those perceptions? Let's discuss what perception is. Perception is shaped by three primary factors. What people perceive is usually based on what they hear, what they see, and what they think. In my extensive ethnographic research, I personally spent 1,000 hours observing patients in a hospital setting. I learned that their perception was powerful and overshadowed everything else when it came to summarizing their experience. When we think of the day-to-day interactions with our patients during the COVID-19 virus, how do we adapt during important interactions with the patient? How does the patient perceive their care when they know staff is overwhelmed and stressed out? And how do we deliver care under such stress and anxiety? These are important questions, and I would like to suggest a few ideas that have been scientifically proven to make a positive impact. When you arrive on the patient's unit, how do you get centered? So in the research, you look at how the patient experiences everything that they go through their eyes. We're going to reflect and talk about today what has changed in that interaction. So arriving on the unit, you're stressed out. It's important that you take a few moments to take a few deep breaths, as simple as that sounds, so that when you enter the patient's room, you appear calm. You will convey calm and caring through your presence, your eyes, your voice, and demeanor. Your calmness will provide reassurance to the family and ultimately create a positive perception. The patient will be watching and listening to you, and your interactions create their perception of care. I found that even during normal business hospital settings, the patient's perceiving their care through the caregiver's eyes. So during an emotion study at the Cleveland Clinic, where I interviewed 140 patients, before, after, and during their care, I found that positive interactions with caregivers created the perception of their experience. So you have the ability, even during this pandemic, to create calm with your patients, to convey that you care and connect with them, whether it's just arriving on the unit, whether it's during shift change of care to the next caregiver that's taking over, how you're observing each other, physicians who are interacting with your patients, and all the multiple staff that interact with your patients. How do we do service recovery when someone's upset? When we discharge the patient? And then, of course, we all have PPE protocol. So all of those are being seen through the patient's experience and through their eyes. And so during this time, even with all of the equipment you have on and the garb that you're wearing, you can still convey a calm connectedness to the patient through your demeanor and your smile and your eye contact. We look at healthcare, and it really is a unique environment. It is the sum of all impressions that we make. We think of each touch point as an important to the other, and it leaves that imprint. When we think of perception, the patient tends to compare their experience based on the caring interactions versus the transactional interactions with no connection is made. They now have a comparison, and their expectations are raised, and they begin to perceive their care based on all of those expectations. So how are patients' perceptions about their experience being shaped during this COVID-19? Let's look at direct observation and experience, what they see. They're seeing your masks, they're seeing warning signs, they're seeing no visitors, long lines, they're seeing your stress and your anxiety, they're seeing the physician's stress. So what's the next best thing that you can do? How can you convey confidence and commitment to safety? You can recognize that they're seeing the fear, you can recognize their stress levels, and you can begin to talk to them and acknowledge where they're at to meet them. When you think about what they're hearing mixed messages. You're hearing mixed messages now. Inconsistent focus and individual fears, direct orders without compassion, because you have to get so much done in such a short period of time. What's the next best thing that you could do? Recognize and acknowledge those fears, give encouragement and hope. Use words that'll have a positive impact. And then lastly, how do we form their opinions and what they think? Are we checking in with the patients and their loved ones? Are you asking, how are we doing? The next best thing is to continually narrate what you're doing. Ask for feedback and receive it with grace and appreciation. You can use this opportunity to review their improvement from the previous day, or how the sun is shining today, or that you heard a positive story. You could narrate for them and provide a new positive thought, because you are continually shaping their perceptions. So how do you have a positive effect on changing perceptions? I wanted to look up what were hopeful words and phrases that you could use. You want to be able to say words like, I am confident, I trust, I expect, we have high expectations. You can even use the phrase take heart, I'm hopeful, or I'm looking forward to. All of those will give a sense of hope and joy into the situation that's stressful, and help change and the perceptions that are going on with your patients to help mold it into something more positive. You also are being present for your patients, which reinforces the strength of a team, the team of we. And then influencing the power of the thoughts by creating, being creative with inspirational scriptures, music, FaceTime them with their friends or family. And that works for you as well if your perceptions need to be changed or inspired. You have to go and you have to inspire yourself with words and laughter with friends. And I know that certain hospitals are setting up certain rooms for you to go to. Take time to do that, even if it's just for 5 minutes, because it will help you in the perceptions that you are presenting to the patient. So let's talk about a few solutions that you could use right now. One of the things that you can influence perceptions is using the patient's name and your name. That's a connector. Use the patient's name every time you encounter them. And I use this photo here because maybe they aren't going to recognize your face. Maybe you're in so much coverage that they can't even see your face other than your eyes. So using your name just sets that warm connection right at the beginning. Introduce yourself completely, even if you're just saying it every time you come into the room. Hi, it's Brooke again. I'm checking on you, Mr. Smith. I just want to check on, see how you're doing. And again, you can use that hopeful tone when you're talking to them, but reinforce their name whenever possible, because it creates memorability. And make it possible for the patient to remember a name and a face, or a name and a mask, or if you have a picture of yourself on your mask, on your breastplate, they'll see who you are with your name tag and they connect with you. The second thing to build that relationship is ask them questions. Just ask them a personal question just to break the ice. Where were you born? What do you do for a living? Tell me about your family. Do you have a favorite pet? Tell me what's important to you. And maybe you can just say, has anything brightened your day today? Something hopeful. It doesn't have to be large. It doesn't have to be earth-shattering, but it could be small. It could just be the fact that you got to discharge some new patients today and people are getting better, or something that brought happiness to you. It could be that your child wrote you a special note today before you went to work. All of those things help build a relationship with a patient on a human level to make that connection. And thirdly, what's available to you to impact perceptions? That whiteboard. That whiteboard is now a link to communicate with you and your coworkers. It's a way for you to really convey to the patient that you are keeping in front of them and giving them up-to-date information, that you are helping them know what to expect, because in an ever-changing environment, the perception often is fearful and they don't know what to expect. So this is a way just to reaffirm everything that you're doing for them. And even if you feel like you're repeating yourself, that's okay, because patients need to hear it over and over again to be confident in knowing that you are in control and taking care of them. So use that whiteboard in a way. Maybe you put an inspirational saying on it. Maybe you're an artist and you draw something funny on it, but use it as a way to communicate in a personal way to have that impact. Here's the best part. Your smile is your logo. Your personality is your business card, and how you leave others feeling after having an experience with you becomes your trademark. So perception is important.